Hello and welcome back to RT-Matters, where conversations take place about what matters most to respiratory therapists. I'm your host, Patrick Dunne, and we're delighted to have you join us for yet another episode of RT-Matters. And just as a reminder that this, as well as all prior episodes of RT-Matters, are available through your podcast app of choice. It's open access, no charge, no subscription fee, no membership requirements, so let your fellow RTs know all about us. Now on for the topic for this episode. You hear a lot about the advantages of continuing your formal education after entry level, but there's a cost associated with that. Clearly, scholarship opportunities would help. So what are options and what are available? What about that great clinical research idea you have? Are there any funding sources to help out? Or you know a fellow RT who's always above and beyond in how they practice. Is there some way to get recognition for such special colleagues? And then there's the matter of recognizing excellent manuscripts submitted by fellow RTs that appear in our publications. How to recognize such authors, and I might add, encourage others to do the same thing. Well, our guest for this episode will answer these questions and provide some additional insight into one of our profession's greatest assets, the American Respiratory Care Foundation, commonly referred to as the Foundation. Joining me for this episode is Carl Hinkson. Carl is currently the Senior Director of Ancillary Services at Providence, Swedish, North Puget Sound area in Washington, state of Washington. He oversees multiple departments over 3 campuses, and in that capacity is responsible for almost 400 full-time equivalents. Some of his lines of service include respiratory care, EKG, EEG, cardiopulmonary rehabilitation, inpatient and outpatient acute rehab therapies, and diagnostic imaging. You're one busy person, Carl. I should also point out that Carl is a registered respiratory therapist. He also has his specialty credential in adult critical care, as well as his specialty credential in neonatal pediatric. He was inducted as a fellow of the AARC in 2011. Now, more recently, he currently serves as the past president of the AARC. He served as president between 2023 and 2024, and did so following several years of involvement with his state society, the Respiratory Society of Washington. He's currently, in his capacity now, today, joins us as the chair of the American Respiratory Care Foundation, leading a much-needed major operational and organizational overhaul. Carl, welcome to RT Matters. We're glad to have you with us today.
Thank you, Patrick.
All right. One of the points that we have, one of our features, is have our invited guests share with our listeners how they got into the field of respiratory care. And everybody has a different option to get in. What's the first time you encountered a respiratory therapist? Can you recall that time?
I think the first actual respiratory therapist I encountered that I can recall was the director of clinical education at the college, at Highline College, that I attended. So as a young man, I was working at a grocery store, had attended some college and really didn't feel like I had much of a direction. And I kind of came to the realization that if I didn't make a change, I would wind up working in a grocery store for the rest of my life. And so I looked at some available options for programs, and I liked healthcare. I found healthcare interesting. I knew I didn't want to be a nurse. And so I kind of found the respiratory care program at Highline College. And I took the leap of faith to apply to the program, got in, and then just never looked back.
Yeah, well, that's great. So that's where you had your entry level. So you were actually looking to get into some degree of healthcare following high school, probably like I did, which is, barely got through high school, and I found into respiratory therapy. So I noticed that 12 years later, after you got your associate degree in your registry, you decided to continue your education, and you returned and obtained your bachelor's degree in respiratory care and eventually your Master of Science in Respiratory Care Leadership. What motivated you to go back after you already had an established career to get these advanced degrees?
I think it was just more or less ambition. If you go back to that time frame, especially in Washington State, it was uncommon to run across people with a bachelor's in respiratory. And if you want to look forward to a career in research or in management or anything else, it really would help your game to have a bachelor's degree. And around that time, I got involved in a research project, which really got me interested in doing research. So a mentor of mine Michael Benson, more commonly referred to as Benny.
Benny?
Yeah, he's kind of a local legend in the 80s and in RT in Washington. He and I did a research project together, and it got published. And so that kind of motivated me to learn more. So after I got my bachelor's degree through the University of Kansas, I got my master's degree from Northeastern University in Boston under Dr. Tom Barnes's program that he ran.
And you specialized in leadership and clinical research while you were pursuing your master's degree.
Yeah. So the way that program was built, it was kind of three pillars. You could say you had your RT half of the program, you had a leadership portion, and then you had a specialization portion. And I decided, I don't know why at the time, that I would do two specializations. So I did healthcare leadership and then the research portion. So,
well, it certainly helped with your present position now that you had so many departments over your help. And I also pointed out you were one very effective president of the AARC for the 2 years you were there. But we're going to talk more about your involvement with the foundation here in a minute. But I wanted to press down. I noticed you got your RRT right after you finished your 2-year program at Highline. And then in 2012, you decided to get your specialty credential in adult critical care and neonatal pediatrics. What prompted you to go beyond and above and beyond your RRT credential?
That was pretty much a result of the Northeastern program. Dr. Tom Barnes was very emphatic that if you are leading an area that has a specialization, then you should probably have the specialty credential for that area. And at the time when I was working at Harborview as a clinical specialist, we had developed what we called the pediatric core group. So I felt that to kind of show that I could show competence or earn some competence in that, it would hopefully motivate others to also get their credentials. And then I think the year I got the ACCS was the first year it was available. And so that was always my clinical area of working was adult critical care. So I just had to have that one.
Mm-hmm. Well, certainly it's paid dividends. You certainly have had a remarkable career. And we point out that you took the initiative earlier in your career rather than waiting much later in your career. And that's what we want to encourage our new entrants. Don't waste time. Once you get your entry level, decide if you want to go up in the career, you better prepare yourself now and not waste time. Well, let's get on to the topic for this episode, the purpose of the American Respiratory Care Foundation, or the foundation, and why it's such an important resource for the RT profession. The foundation has been around for over 40 years now and still kind of unrecognized. What's the primary mission of the foundation now that you're the chair? Please.
So the foundation really is the philanthropic arm of our profession. The primary mission for the foundation is that we provide funding for respiratory research, education, achievement awards, and we also support the International Fellowship Program. Why are these important? These are key activities of our to recognize our profession. Research develops and grows and validates the work that we do through scientific basis. We have scholarships that help people on their educational journeys. And then we have achievement awards to recognize specific achievements and respiratory therapists and physicians and those who have contributed significantly to the respiratory care profession in different ways through that. So that is why the foundation exists, is to be the kind of philanthropic arm of the profession.
To help promote the profession in terms of research and recognition and encouraging other members of the profession to go ahead and take those chances as well. It's structured as a 501c3 corp. What does that mean?
So that means we are a charitable foundation. That means we have a tax-exempt status. So we can take contributions, and those contributions can be deducted from your taxes. And there's probably more legalese behind it, but essentially we are a charitable foundation for scientific, literary, and scholarly activities.
Yeah, all money obtained either through donations or endowments go right back into the mission of the foundation to make sure that it's distributed. The foundation is governed by a 10-member board of trustees. And how are the trustees appointed?
So as part of the recent overhaul, we rewrote the bylaws. Interesting, the articles of incorporation that are done in Texas give the American Association for Respiratory Care, the president of the American Association for Respiratory Care, the authority to appoint members to the board. We've restructured the 10-member trustees to be 2/3 from the AARC board of directors, and then 3 members that are at large, meaning they can come from any part of the respiratory community, don't necessarily have to be respiratory therapists. So we looked for individuals in the recent years who had expertise in research and in industry to round out the board, round out the trustees to have a better whole representation of the foundation.
Yeah, it also puts you in touch with some of the trends that are going on in the industrial side of the profession in terms of new ventilator modes and new companies coming into existence.
Absolutely. And one of the other I think restructures that we did is I took the governance structure from the AARC and applied it to the foundation. So in addition to the trustees who should focus on governance, we created 4 committees that report to the trustees. And one of them is the research committee that is co-chaired by Mike Gentile and Brian Walsh, 2 expert researchers, and they govern, or they oversee, the research program for us. And then we have an achievement award committee. So these are the groups that look at making the selections for some of our achievement awards. The scholarship committee that will make the selections for these scholarships. And then a new one for the foundation is an annual campaign committee. And this group looks at fundraising activities. And using this governance structure approach allows the foundation to sort of broaden the number of volunteers and who contribute to the work. And so it's not just the trustees doing all the work. We can kind of expand, many hands make light of the work.
Sure does. Well, we'll talk more about your foundation's gala event, the fundraiser at the AARC Congress in a little bit. But you also have indicated you get donations. But what about these endowments? How does that work? Just a little bit about the endowment effect that you have.
So there are multiple endowments that the foundation manages. And so essentially if Patrick, you want to create an award in your name, we'll call it the Patrick Dunne Smooth Talker Award of the Year.
Flattery will get you everywhere.
Yeah, exactly. You would give the foundation a sizable sum of money, and our beginning size is $50,000. And what that does is that becomes the corpus of the endowment. And then the foundation has treasury bonds that earn dividends on those endowments. And then each year we would pay the award out of the endowment, the dividends of that award, never touching the main principal, the principal of $50,000. And then that endowment can never be used for any other purpose. So I can't, as the trustee, or as the chair or any of the trustees, can't use that money for any other purpose. So we have multiple endowments where the monies that's accrued from the dividends goes only to those awards.
And I should point out that all that information is available publicly because you file your income tax returns and also your financial statements.
Yeah.
And so all that information is publicly available to be reviewed. So you're obviously very diligent in what you're doing. I wanted to point out, you and I, you talked about being a smooth talker. I don't know if you remember, but back in 2020, You and I had a conversation because there's a bit of history involved with your facility at Providence Regional Medical Center in Everett. You had the first diagnosed case of COVID. And remember, we had that conversation a long time ago, and you were really kind of in the front page for a lot of times for that. Oh, yeah. I guess a resident came back from China and was identified and admitted to your facility.
Yeah, those years kind of blurred together in hindsight. Yeah, my facility holds a unique spot that we had the first diagnosed patient for COVID. And I actually can recall the time when I thought it was a nothing burger before everything blew up. So,
yeah, I remember talking and you were telling me all the changes that you had to go through. And it's like, well, respiratory therapy can change. And we just did it. You can actually put ICU beds in the parking lot in a fast unit type thing. So it was really a wake up call. Well, let's talk about some of the various awards that you have. The most important for me is research, and it obviously is close to your heart. And I should point out in 2024, the foundation awarded over $25,000 to individuals producing and pursuing clinical research. Tell us one of the newest ones, the AARC Vision Grant. That's a new research award that's just come into existence this year.
So the AARC Vision Grant has existed for many years, but it was housed within the AARC. And I think it just made sense from a governance standpoint to have the AARC Vision Grant housed within the foundation. And so we do an RFP process where researchers send proposals to us and they're graded and there's feedback provided to researchers. And then we give each year, it may be a different amount, but sometimes we'll give researchers up to $50,000 for their projects. And then typically there are certain metrics they have to meet in order to continue getting funding. This has been important for the foundation and for the profession. As if you try to break into research as a respiratory therapist or assist with research, one of the big challenges is how do you get money to do the work?
Right.
And so this, we hope, is a method that people can come to reliably and get some funding for their research projects. And we're tailoring the process and really kind of fine-tuning the process to mimic how you would go seek funding from like the NIH or other governmental agencies. So as if you're coming to us as a young researcher, we use the process to teach you how to get funding from other sources. And if you can complete a project with the foundation and get published, then that starts to create your
legacy,
right, that you can then use to as proof that you can do research. So this is kind of the long strategy to get more respiratory therapists research and publish patients. We have several research funds that are within the foundation. And so the AARC Vision Grant is the newest one. But we also have the Francis B. Parker Research Fund. We also have the Jerome Sullivan Research Fund. We also have the Craig Smallwood Young Investigator Fellowship.
Now that's a relatively new one. That's another new one, isn't it? Tell us about Mr. Small, and then it's really important to understand where these legacies come from.
So Craig Smallwood was a researcher, I think in the Boston area, and we lost him way too early in his career. He was a fairly young man, and so this investigator award was set up quickly after his passing to kind of honor him and his legacy. And so it is the information's on the website. We would love to be able to give the money out. As I tell people, as the chair of the foundation, my job is to ask for money, and then the committees and the other trustees, their job is to give the money away when possible. So,
and it's really a very nice. I just disclose I did serve as a trustee many, many years ago, and one of the highlights was always to sit down and look at all the manuscripts and realize there's a lot of excellent work out there if we can just continue to stimulate people to do it. And I like the idea that you're now going to start the respiratory research on their way. And I had an interview with Bob Joyner, who is director of research over in Eastern Maryland. And one of the points was, why do therapists shy away from research? He says, well, it intimidates them at first, but once you get into it, you get hooked. And, you want to continue to go. And that's exactly what the foundation seems like it's trying to do, is to get them hooked and get them on their way, because we need more research to validate our clinical expertise at the bedside, especially in this time of moving toward value-based therapy, where we're not counting the number of procedures, but how well the procedures you do turn out in terms of patient care.
Yeah, absolutely. So I think, strategically in the next couple of years, trying to get the word out about these research funds that are available to young researchers to try to avail themselves of. And the other part of this is why I get the word out is, well, you can donate money to the foundation so to help other people do research. So
right.
It is not only can you give, but you can donate to the foundation, support the profession that way.
And that's a tax deduction because of the philanthropic. No, we mentioned an important component of the foundation to support students continuing their education, not just during entry level, but after entry level and postgraduate. Tell us a little bit about some of those awards and how they measure up.
So we have several student awards for both undergraduates and graduates, and these are often these are scholarships that are named after individuals that have been very substantial in education or in leadership. And so we have, for example, we have the Morton Duggan Memorial Education Recognition Award, and that award's up to $1,000. To a qualified recipient. And then we have, the Jimmy Young Memorial Recognition Award, one of the most important people in our profession, Jimmy Young.
Right.
And then several other awards. And we even have some smaller awards that are housed within the foundation that kind of serve local areas. So the Joyce Kallstrom Memorial Scholarship kind of focuses on a very local area in Kansas and Missouri.
Right. And you basically said earlier you cannot change that. So that is designated by the people who make the endowment. Mm-hmm. They direct how it goes. And then your job is to follow that to the letter of the law. That's for sure.
Precisely. So the people who create the endowments and the awards, they're the ones that decide what the criteria is. Generally speaking, they decide what the criteria is. And then the committees will decide who gets the recipients, but we always follow the endower's wishes when we accept an endowment. So, and
that's
times, at times we do go back and ask for changes. I think we recently were talking with Forrest Bird's daughter to kind of make some changes to some of the accounts there to kind of make that more sustainable for the future.
Yeah,
so. Sometimes we do go back and ask them.
Sure. I mean, times are changing. The economy is certainly changing, and you're an organization that manages about a $4 million fund. So you really need to be on top of what's going on and the interest rates are not really that favorable today as they were like 10 years ago, where you could probably cover the cost of the prize of the award recipient and so forth.
Yeah. That's something that's kind of, some of our funds kind of track with the stock market. So if the stock market has a bad year, so does the foundation, so to speak. We're pretty much reliant on donations.
Now, the other thing that's nice about the foundation that I find that's not being well received or not being well understood, and that's postgraduate, people going on to get their advanced degrees, which are necessary for education, in your case for administration, and also just basically to kind of go up the career ladder. And that's talking master's and even a doctorate degree. But you have a special postgraduate section for applicants in that area.
So we have several awards. We have the NBRC Gareth Gish Memorial Postgraduate Award, and we have the William Miller Postgraduate Education Award. Both of those award $5,000 each with assistance. And you get recognized at the award ceremony at Congress. And when I was going through grad school, $5,000 is very helpful. And I'll happily write a paper and or an essay if I can get $5,000 from it. So
sure.
Again, these are things, we send out the request for proposals in January. I know we're like the deadline's tomorrow, so probably won't help people who hear this right away. But for next year, people listening to this podcast can keep in mind that, keep it on their calendars to apply for these awards.
Now, the other thing that I like is that you're so diversified in terms of how you look at your awards and recognition. The other one is the literary awards to encourage RTs to publish their data, not just necessarily research, but basically some good clinical care scenarios. Let's tell a little bit about those literary awards and how does that go?
So the literary awards, these were created endowments. In this situation, one's by Mallinckrodt, and then the other one is by Draeger, recognizing the Draeger Shaeus Roy Memorial Award, a stalwart from that industry. And one award is for the Draeger Shaeus Roy Award is for the best published paper. So if you get your paper published in respiratory care, the editorial board will decide which of the papers they think is the best one of the year, and that it becomes that recipient. And then the Mallinckrodt Literary Award is for the best first-time author. So when you publish a paper, if this is the first time you are the lead author on a publication, then the editorial board looks at that. And these are fairly important awards. Mm-hmm. It recognizes, I think, excellence in our publication. Again, it recognizes people who are doing good work. Because publishing research by respiratory therapists is very important. Like you said, we need to document and validate the quality and the value that we bring to the bedside. Without these publications, then we become susceptible to the CFO or the C-suites who are looking to cut costs and not always looking at the quality value. So we need to demonstrate that value. And again, this is kind of the mission of the foundation. When we look at, we're recognizing people doing good work, and we're trying to help people who are publishing, showing the work that we do is good.
Yeah, but at the same time, you're also motivating others to maybe go down that road and think about publishing, because we really want to try and do two things. We want to reward the ones that are doing it, but you also want to motivate the next bevy of leaders to come in and do their job. Now, another popular feature of the foundation is to recognize respiratory therapists and others who have gone above and beyond the normal commitment. These are the Achievement Awards, and these are pretty popular because they're pretty hefty financial rewards for people who do the best job they can in certain areas. Let's take a look at some of them. Why don't you talk about the Mitchell-Barron Award?
So the Mitchell-Barron Award is was endowed by Monahan to recognize Mitchell-Barron, the founder of Monahan. And the cash award is $2,500. And, speaking with the leadership, we retooled this one to recognize that early or what we call mid-careerist who's really beginning to advance the profession. Like you say, Patrick, like how do we encourage those people to advance in the field? And looking at those people who don't have, as we might say, the usual subjects who get the, usual people who get all the awards. Somebody who's really shining, kind of not maybe like first in their career, but been in for a few years, but not been in a long time, who are really shining, to recognize them.
Yeah, I knew Mitchell-Barron very well. I consider him one of my mentors, and this is exactly what he wants. He wants to build the future of the profession by taking the people today and encourage them to go further in their careers. So this is really right up their alley. You mentioned Forrest Bird family has been in touch with you. They have a Lifetime Scientific Achievement Award, which is a hallmark. I mean, that's a pretty heady award for a lifetime achievement, especially after Dr. Forrest Bird. What is that primarily based upon?
That is based upon, there's very specific criteria about the number of publications you have to have completed. It is really recognizing individuals who have a substantial scholarly achievement, throughout the course of their career. It's absolutely a lifetime scientific achievement award. Right. I think this year's recipient was Rob DeBlasi, who runs the research clinic in Seattle Children's Research Center, and his name is synonymous with research in respiratory therapy, and it's a very prestigious award. Dr. Forrest Bird was very important to the respiratory care profession. Respiratory therapy as a profession is very important to his family. So this is a very prestigious award to give.
Very much so, very much so. You also have the Charles Hudson Award for Cardiopulmonary Public Health. And I like that one because that's basically now going outside of our specific area and looking at individuals in other walks of life that had an impact on respiratory public health.
Yeah, very much so. So this one is recognizing people who promote respiratory care to the general public. Slipped in my mind right now who we gave it out this last year, but this is for people who are out there promoting lung health, getting out into that public space and helping out.
When I was back on the foundation, one of the things that we achieved was to help get cigarette smoking eliminated from airlines. And we recognized several states' attorney generals who actually took lawsuit to the federal government, to the aviation administration. And that really helped because that shows that we're actually supporting legislation that really can have an impact on public health.
It's an interesting point that you make, Patrick, is I don't know how many new respiratory therapists that are coming into the field today know that the AARC and the foundation had a large part in getting cigarette smoking off of airplanes.
Yeah, no question about it. And it was just, it's hard to realize that people could light up once the cabin light went on. It was just terrible. Yeah. Anyway, you also have for home care, because we're expanding into the non-hospital application of care, you have the Thomas Petty Indicare Award. Tom Petty, of course, was a long-term home care, home oxygen proponent, pulmonary rehab proponent, and this was endowed by his estate. Why is that important for respiratory home care therapists?
So these are unsung heroes who work sometimes in clinic spaces. They often will go into families' home, and really what they do is they improve the quality of life for patients with substantial cardiopulmonary disease. And I think we've had some very I feel challenged sometimes when we give this award out because we've received so many strong applicants. I feel like we could just give this award out year after year after year for people who work with, like, say, pediatric patients on ventilators, teaching people with muscular dystrophy or other spinal cord injuries how to live with their diseases and stay out of the hospital and have really full lives. And I know the
real focus here, these are all chronic conditions you're talking about. Yeah. They're lifelong. They're not curable, but they can be managed with the proper assistance and proper education. And that's what the Petty Award is trying to recognize. Respiratory therapists who take it upon themselves to help people with a chronic, debilitating medical condition live a better life.
Yep, absolutely. And that, you touched on it, but that was what Dr. Petty really, back when he was practicing, which was a long time ago. And now I say a long time ago. I'm 30 years in the profession this month, so that's why I can say these things. Sending patients home on oxygen was a novel idea at some point. And to now even think like we're discharging patients with oxygen to go home all the time now, there was a time where this was not common practice, and it was really innovative to teach people how to live at home on oxygen, teach people how to live at home with a trach. And so it's really, and to see that work continue is really awesome.
Dr. Tom Petty was smiling on us because I remember one of the points that he made. I asked him one time, he published a book, Pulmonary Rehabilitation, back in the 1970s. And he said he took a lot of heat from his colleagues in a ribbing way because nobody believed that rehab could actually have an impact on the outcome of a COPD patient. Now it's considered to be one of the most important, aside from no smoking, in terms of patient success and longevity. And at the same time, when I was involved, he had what they call Moving Mountains, a seminar for patients in the Denver area every fall. And I was invited to present one time on the new Medicare guidelines for home oxygen. And everybody's walking around calling him Dr. Tom. And I said, Dr. Petty, does that bother you? He says, hell no, I am Dr. Tom. And if I can talk to them as a Dr. Tom, so be it. So he took that as a sign of empowerment from his patients. And, most docs up to he would have thought, no, it's Dr. So-and-so. Dr. Tom, he loved it. That was his favorite name. All right, there's one last I want to talk about, because you're also promoting educational excellence with the Gary Smith Educational Award from the NBRC for Innovation Education Achievement. And of course, the big kick here is when states are moving to the baccalaureate entry level and they only have associate degree programs, we need to have these distant learning programs to allow them to get their online degree in a bachelor's program. Is that what this is designed to do, to create some innovation?
Well, this is awarded to educators who are doing innovative work. It's not awarded every year because we don't always get applications. I want to sit here and if I can. I want to say it's on the tip of my tongue on who we gave it out last year to.
Well, that's right. That information is available on the website, so it's no problem. Yeah,
it is. They've done some research and some advancement into the education space. Yeah, and some awesome work comes out of that. So recognition for their what they've done. And
we're seeing an awful lot of simulation labs set up. So that's another part of the innovation we got there. Well, finally, let's take a look at two other important actions of the foundation. That basically the support for the International Fellowship Program, which is dear to my heart, and your periodic journal conferences, which I think are really another one of those unknown aspects of the foundation. Let's talk about the International Fellowship Program. Why is that important?
So the International Fellowship Program has been around for, I want to say, over 20 years.
Yeah, about 20, 30 years. Yeah.
20, 30 years. Yeah. And it was implemented to promote respiratory therapy worldwide. And so clinicians from other countries who had an interest in respiratory care, they would apply to the program, and then they would be, on our dime. We have a fund in the foundation. We would fly them to two cities. They visit two cities hosted, and while they're there, they go visit respiratory therapy departments of various hospitals. They see how respiratory therapy has been delivered, and then maybe go to an education program. And then, after two visits to a city, we bring them to Congress where we honor them. And they get to see the Congress. And this has been a very useful, important program that has helped to grow respiratory therapy internationally. And it's, once you see the size of the international community, you see how much the profession is growing worldwide. Right. It's not, and I know people we use the term black pilled about the profession because we hear something bad in the news, but the reality is that the profession grows.
Oh, absolutely. And the nice thing about that international program is years ago, the thought was, and we realized it was wrong. This is how we do it. This is how you should do it. Not realizing that every country has a different healthcare delivery system. So what might work in one country won't work in the other. But respiratory care that they observe, they can take that back and integrate it into their country's healthcare system. Some of them have followed us, like Saudi Arabia, Israel, Ghana, and some basically nurses and physicians wind up being respiratory care or physiotherapists. So the idea is we teach them the basics and then they go back and make it work within their particular healthcare delivery system. And I think that's a much better approach than trying to say, this is how you do it. This is the only way you can do it.
Exactly.
Yeah. And the other thing that's nice about that is that it's all volunteers. Once they get here, you have host cities you mentioned where they actually apply through their state affiliate to be a host city for one or more of the fellows. And then they will work among them therapists in that particular city to find them lodging, to maybe they invite them to some family social events, show them a little bit of the culture. And then they go to the next host city with hosts that they're also recognized at the international reception. So it really is a nice team effort, and they build a lot of long-lasting relationships through that process.
Yeah, absolutely.
All right. Now, what about journal conferences? That's something that really touches your heart because you're a researcher. And that's exactly what a journal conference is selected to do, is to get the latest information about a particular topic. And then, well, I'll let you explain. What is a journal conference? So
the journal conference is an invited event where the editors of the journal will determine a particular topic. And then they will come up with a slate of presenters or authors, and each invitee is invited to come and present a topic, write a paper about the topic, and then they come together. There's presentation, there's discussion, and then there's a publication. So every year the journal publishes 1 to 2 issues that are specialized around these specific topics, which are in-depth review articles. And for example, you may have one on controversies in respiratory care, pediatric asthma, COPD, in the home, different topics. This year is going to be the current state of respiratory care and where is the science, and it's going to be multiple areas. And I'm co-chairing it with Dean Hess and Dr. Mark Yoder, and my particular topic is going to be management and respiratory care and where's the research. And so we're doing that in September. This is it's an invited event. We do invite corporate sponsors who can then come and observe. And so it is, and it'll be published next year.
Yeah. So, and then again, part of the criterion for acceptance is that you agreed that the manuscript you submit will be ready for publication in respiratory care. And that's peer review, I should point out. That's a true peer review journal, and that's the highest standard you can have for publishing scientific information in this episode.
Yeah. Well, what I should also point out, yes, and often these journal conferences wind up being frequently cited as well.
Yeah, no question. I participated in 1 or 2 over my career, and and the thing that's amazing to me, like you pointed out, there's a discussion after you present your paper. You then have a discussion, open discussion with the people who are attending. And so you have to almost like defend your paper to people who are there, which I think is another level of expertise that you bring into that whole process.
Well, you're sitting in a room with other experts. So
That's right. All right. Well, let's finish up here and talk a little bit about when and where are the recipients of the Foundation Awards recognized?
So we recognize them at the award ceremony at Congress. So it is our time to shine. The award ceremony, if people listening to this have never been to Congress or never been to the award ceremony, that is the one event where we recognize our own, and it is very prestigious. It is very great to be honored amongst your peers, to receive an award and walk across that stage. And so, yeah, we have a great award ceremony where we give the awards for the scholarships and the achievement awards.
What's also nice to me is when the recipients are on stage or going on stage, they have their cadre of supporters in the audience who all break out in applause and standing ovations. So it really does show that the profession really is united, and people stand up for people who they're very proud of. And instead of being jealous, they're proud. And I think that's an important part of that award ceremony. Well, this year it's going to be on Saturday, November 14th. The Convention of Congress is in New Orleans this year. How do you apply for the scholarships? I know we have the website. Let's go ahead and give our members the website.
So the website is arcfoundation.org. And then all the information to apply for any of the scholarships, research awards is on there, the criteria. You can download the materials, and when you submit, it will all go to our extraordinary executive assistant for the foundation, Crystal Lighton, and she makes sure that all the applications have everything that's needed, and then she nicely presents them to the committees for review, and then she also assists us with the all the back end stuff and the ordering the awards and everything. So, but I just again encourage everyone go to the ARCF Foundation website to look up the criteria for the specific awards. If you're a student listening to this, if you're in your pre-licensure program, if you're a grad student, or more importantly, if you're trying to work on a research project and you're looking for some funding, we want to be the place you come to.
Yeah, no question about it. And again, research is so important, but at the same time, encouraging people to continue their education is right up there. Now, another thing that I wanted to point out, and that is that Crystal also helps identify the host cities and the hosts within the cities who want to be involved. So she should be an important contact for those that want to get involved in the fellowship program. Do they work with her direct, or they go through the foundation?
They go through the foundation. So we have the international committee, who's chaired by Ari Arzu. And so she works closely with Crystal to make those arrangements.
Got it. Okay.
Crystal is really kind of like the oil for the engine that makes everything run.
No question about it. All right. Another finally popular event is the fundraiser that you mentioned earlier. And I've attended several of those. And I got to tell you, it is exciting to rub elbows with all those people that attend the fundraiser. It's usually held the night before the Congress starts. Tell us, this year is typically always sold out, I should point out. And this year is called Black and White Gala.
Yes, Black and White Gala. So this year's event is going to be at the Missy, which is located on the third and fourth floor of the historic Jack's Brewery building in Decatur Street in New Orleans, not far from where we will all be staying. And so this year's theme is it's a black and white and gold gala. So the site has a black and white and gold theme, and so we kind of have fun with this. So you don't have to dress up. But some of us do, especially when you're the chair, you're kind of expected to dress up a little bit. So, and it's not an exclusive event, so everyone's invited. This is our fundraiser. So, the monies that we raise from this go directly to support the activities that we do. We're not looking for making a profit. This is all the monies that come to the foundation. They're paid for operations, but it's to raise money for our activities. And so it's what we, yes, it's typically sold out. We're trying to avoid that. We're trying to offer a at the door option. And so we have an early bird price, and then we have a for until July 12th price, and then or our early bird is $125 until July 12th. So I better get mine, and then $150 until November 1st, and then $200 at the door.
If there is any availability when you're on site,
this will sell out. And again, it's not exclusive, but you have the opportunity to come promote the profession and celebrate, and then meet some extraordinary people.
Right. And I also point out I have a phone number for Crystal at the executive office, the AARC executive office. It's 903-340-7270. And she can also help you, direct you toward if you want to be a host or a host city, and at the same time, tickets for the gala. And like you say, you don't want to wait because it's going to sell out. All right,
Patrick, before we wrap up, I do want to add that, that's been our typical Congress event, but this year we're actually having a summer forum fundraising activity.
Oh, very good.
So we are selling, or for a donation, you can get a rubber ducky with an ARCF logo, and we have all sorts of activities related to winning prizes and different types of ducks. But so if you're coming to Summer Forum, look out for some rubber ducks. You can buy a rubber duck and support the profession.
Yeah. I actually saw that on the website, and I wanted to point out that the foundation website is very, very user-friendly. You can go anywhere through there and get any information you want on the award. And I compliment you and your webmaster, because that's really it's nice to have something that's user-friendly in this day of complexity.
I agree.
All right. Well, thanks so much to our invited guest, Carl Hinkson. He's the chair of the American Respiratory Care Foundation. He's also the past president of the AARC up until this December, when the new officers take over. Let's repeat. The best way to explore the grants is to go to the website, and it's arcfoundation.org. Any final thoughts or words, Carl?
Well, thank you, Patrick. This was really enjoyable. And I would be a bad chair if I didn't ask for people to go to the website and donate and support the profession. So
absolutely. That's what we're all about. All right. Well, that brings us to another end of an episode of RT Matters. We want to thank Carl Hinkson, our guest, for insightful, meaningful conversation about a very important resource for the respiratory care profession. Now, remember, we always want to hear from you, our listeners, about what you like about this episode or others, and what we can do better to make RT Matters work for you. And you can also request any additional information from any of our episodes. You can email me directly at feedback@rtmatters.com, and I'll be more than happy to respond in a quick way. RT Matters is now the virtual voice of respiratory therapists everywhere, so please let your fellow RTs know about us and how we can help. Now, in the meantime, go out and be the best possible respiratory therapist you can be, because our patients deserve nothing less And as a highly skilled, highly trained, licensed healthcare professional, we expect nothing less from you. So until next time, be kind to yourself and to others, and remember, RTs do indeed matter. So take care, be safe, and when all else fails, choose to be happy.